Hello, and thank you for joining us today. My name is Ellie Macmillan.
And my name is Jamilet Delgado.
And my name is Christopher Royster. And today we're going to be discussing the difference between hospice versus palliative care. But before we begin, there is often some level of confusion regarding the differences and even similarities between hospice and palliative care. Many have argued that one is superior to the other, or neither are they as beneficial to senior citizens as they are portrayed to be. Thus, to clarify the correct distinctions and similarities between both systems of elderly care, today our team of advocates will present vital information explaining what hospice and palliative care really means. What is hospice care? Hospice care is homely care that isn't intended to assist in the curing of a patient or the prolongation of their life. Rather, it is a system of care that is used for those who are close to the end of life. Additionally, hospice care is typically intended for elderly who are within 6 months of passing. Hospice care gives patients a comforting and positive living situation to spend their final days. Patients are provided the essentials needed for everyday living with an opportunity to experience an environment of peace.
What is palliative care? Palliative care is essentially comfort care. This is care that is meant for people with any serious illness on top of their normal treatments. This could focus on medical or mental issues and may include physical therapy, occupational therapy, or spiritual wellness. Palliative care can start as early as diagnosis and is able to be stopped and started as needed and does not mean end of life care.
Additional differences. Hospice care could take place wherever a patient lives. It is the sole Medicare benefit that provides pharmaceuticals, medical equipment, 24/7 access to care, nursing, social services, chaplain visits, grief support following a death, and other services deemed appropriate by the hospice agency. Whereas palliative care can start at diagnosis, and hospice care can start when patient has exhausted all medical treatments.
Now we are going to go into some of the goals and principles of hospice versus palliative care, starting with palliative care. These 6 principles highlight the care that should be expected from all palliative care patients. These principles were outlined by the Agency for Clinical Innovation, and now we are going to go in further detail about each principle. Principle 1. Care is patient, family, and carer centered. Palliative care is centered around everyone that is involved with the treatment of the patient and is aligned with the patient's goals. This does include comprehensive care for everyone that has been impacted, including family. Principle 2. Care is provided on a base assessed needs. This care is based on the assessed needs and personalized goals because these needs may vary. This needs-based assessment ensures effective referrals when necessary for the patient. Principle 3. Patients and families and carers have access to local and network services to meet their needs. It is known that seniors wish to be at home or close to home, and palliative care gives the flexibility of being treated at home or as close to home as possible, although this is more difficult for people living in remote areas.
Principle 4 is evidence-based care through being clinically and culturally safe. The goal is to eliminate gaps in resources and support. Principle 5 is to have care that is integrated and coordinated. There is always a correlation between the health system and social care. Principle 6 is to have care that is equitable. The goal of palliative care is for patients to get fair and equal access to what they wish.
Principles and goals of hospice care. Principles and goals of hospice care. One of the goals of hospice care is to employ care providers with different professional backgrounds. The primary objective is for these care professionals to work collaboratively to address the physical, social, and emotional and spiritual needs that a patient may have. Hospice care emphasizes respecting the expressed wishes and goals of the individual as well as their family members. Patient privacy and input is essential to how satisfying an experience they will have while under hospice care.
Now we are going to discuss how these programs can be paid for. With hospice and palliative care, you could qualify through Medicare and Medicaid benefits. Veterans may also qualify through the Department of Veteran Affairs. Private insurance companies also may help, but they help very little for palliative care patients.
Here we have two current bills of importance. We have the Expanding Access to Palliative Care Act, which requires the Center for Medicare and Medicaid Innovation to test a model that provides community-based palliative care and care coordination for high-risk Medicare beneficiaries that may replace the Medicare Care Choices model. Now we have the Palliative Care and Hospice Education and Training Act. This bill requires the Department of Health and Human Services to take a series of actions relating to palliative care training.
As we have kind of talked about, there's a theme with hospice and palliative care that everyone has a part. It takes a village for these patients to be taken care of. With the patient, they have an equal part to speak and define their goals. With the healthcare workers in palliative care, you can continue with all of your treatments, but with hospice care, all attempts to cure your illness will stop because you've exhausted all medical treatment. This also focuses on comfort care. Palliative care offers different types of therapy on top of treatment and reduction of symptoms to be most comfortable. Hospice care also is to address physical, social, psychological, and spiritual needs to maximize quality. And for the family with palliative care, this also provides resources for families, and hospice care can be provided at home. Now, as we wrap up our presentation, we wanted to give you a series of questions to review what we had talked about. You can find all of the answers to these questions previously in the presentation. Number 1, how early could palliative care begin? A, when the patient has 6 months or less to live. B, as early as diagnosis, or C, 1 year after treatment begins. And number 2, how do you pay for hospice or palliative care? A, Medicare and Medicaid benefits. B, Department of Veteran Affairs. C, private insurance companies. Or D, all of the above. Like I said, you can find all of these answers in the previous slides, but now I will be going over the answers. And the answer for number 1 is B, as early as diagnosis. A would be the question of how early can hospice care begin after all medical treatments have been exhausted. And C is correct for hospice care, but it's not how early it could begin. You can begin hospice care 1 year after treatment begins, but the earliest palliative care can begin is as early as diagnosis. And how do you pay for hospice or palliative care? All of the above is correct. You can look at what benefits you get through Medicare, Medicaid, your private insurance, and if you qualify, the Department of Veteran Affairs.
Question number 3. How can family members or caretakers help their loved ones with decisions related to hospice or palliative care? A, lending a listening ear. B, sharing valuable memories and wishes. C, speak with their loved ones at an earlier stage when considering either hospice care or palliative care. Or D, all of the above. And the answer for this question is D, all of the above.
And that concludes our presentation. Thank you so much for listening and following along. And we wanted to give you some resources of how to stay connected with us further. We will have more webinars like this on our website, and you can follow us on Facebook and Twitter for more updates. Thank you so much. Here is also a list of resources that we used for our Hospice versus Palliative Care webinar, and you can find more resources through these websites. Thank you so much.